But in true presbyopia, it's when your lens inside your eye becomes so thick and kind of dense that the muscle, it's too thick for the muscles to essentially change the shape to allow it to focus at different lengths. Oh, that's weird.
No,
So pretty commonly, you'll hear anywhere in the office, whether it's a front desk and they're making an appointment saying like, oh, I need to make an appointment because, my near vision's not as good, my arms aren't long enough. Or when you take them back and do their intake and they'll say, my eyes feel tired, I see double when I read, or even as an optician, them saying what was wrong with their past glasses. So these are all kind of key phrases that usually indicate the person's presbyopic, maybe for the first time, or that it's progressing since they were last seen. The reason my arms aren't long enough, like we were talking about before, is actually that the lens can't focus up close anymore, so you have to keep holding things further away. Some patients, if they're nearsighted, naturally their eyes can focus up close, and so they might just take their glasses off to see up close. My eyes feel tired, so again, that focusing muscle over the course of the day gets really tired, especially as you get closer to the age of presbyopia. And so people notice maybe towards the end of the day after they've been on the computer or after they've read a long period of time that happens. And then some patients that have difficulty with their eyes teaming might have been able to compensate for it most of their life with focusing, but as they lose the focusing ability, it reveals that their eyes weren't able to work together as well. And so they'll see double. So what is presbyopia? So as I alluded to, the lens fibers that are in the lens start to get harder, and then the ciliary muscles that kind of connect to this are unable to contract or change the shape of the lens. And this usually happens around 40. For people that are farsighted, they might notice it a little bit sooner than someone that's nearsighted, because nearsighted people can compensate by taking their glasses off a lot of times. And it's also known as the loss of accommodation due to age. Ooh. So it doesn't matter your gender or race, presbyopia happens to everyone, just kind of like cataracts. If you live long enough, you'll notice some changes. And then at the bottom, it kind of simulates that with normal vision, you're able to see far away and up close. But if you have presbyopia, things up close become a little bit blurry, even though you can see far away. So there's different methods to correct for presbyopia. Over-the-counter reading glasses is probably the most common. And that essentially is like little magnifying glasses in the lenses, and that helps add focusing power for patients in order to see up close. They're also known as cheater readers, so sometimes they will refer to that. And the reason they call them cheater readers is it doesn't actually precisely correct the person's astigmatism. If they have a different power in each eye, it doesn't correct for that if their eyes aren't exactly the same. So that's why typically people get better vision if they get the prescription filled by the doctor than they will with the over-the-counter readers. But some people do just fine in over-the-counter readers as well, depending on their prescription. So during the annual eye exam, we check their distance prescription, we check for the level of myopia, astigmatism, hyperopia, and then we also check for what added reading power they might need up close. And so that's a plus prescription. So the plus prescription goes up to, usually it levels out that add power at about 250, and that tends to happen kind of in the 60s, that the reading power will level out. And that's because there's calculations, but based on how close someone wants to hold something determines that reading power. So usually kind of arm's length, about a 250 is what it maxes out with. But if patients like to do needlework or anything really close up, they'll want a stronger reading power like a +3. There's a new surgery that was actually approved in the United States just last year, I believe. It's been done in Canada and Europe for many years before that. But essentially, it's kind of like a really small hole protector, if you've ever seen those before. It's like that, a lot smaller and obviously surgical grade, but it's this little black hole that has tiny little holes within that black part, and it helps kind of focus the light essentially in the eye a little bit more to give them more of a range of vision. It's all kind of giving them a little more depth. So it doesn't have power in it when they do that. It's called camera inlay, and essentially it's removable if they want it done, but typically that's not something we encourage. If they're the right candidate, then usually the patient should have it for the rest of their life once they have it done. So for different options that we can do in our office, bifocal lenses, so if you ever see someone that looks like they have a hard line at the bottom of their glasses, that's called a bifocal, and that has that whole area has that additional power in it. A trifocal is when there's actually two sections at the bottom, so you'll see that kind of half moon on the bottom plus maybe a little rectangle on top of that, and that gives them also an intermediate area for like their computer distance. So that's usually about half of the full reading power up close in that middle area. And then progressive lenses are also known as no-line bifocals a lot of times. That's kind of an easy way to explain to patients where it's a blended area of all of their prescriptions. So on the right here, it shows there's the distance kind of when they look straight ahead, and then the intermediate. And so with progressive lenses, a lot of times the optician will have to explain to patients that you need to point your nose where you want to look, because you need to be looking also in the right area. You don't want to be looking off in the sides of the lens for progressive designs, because there's all this blending, you can get a little bit more distortion towards the sides of the lenses. Kids can also wear these different designs for different issues. If they do have focusing issues, that can be beneficial. So sometimes you'll see kids that are also wearing, usually they're doing like a bifocal because it's easier for the kids to find where the reading power is for them. We can also do contact lenses in different ways. They make multifocal contact lenses. It's not quite like a progressive lens design, but it does have various powers essentially, and a lot of times it's based on our pupil size. When we look at things up close, our pupil gets smaller, so we're kind of looking through different power in the contact lens, but that's all a little bit more subconscious. Then you don't have as much control over that. So that's why some multifocal people are really successful, and sometimes there's a couple more visits to kind of fine-tune with how their eyes work in light and things like that. And why we also tell them you need a lot of good light when you're reading up close, because having a smaller pupil helps with focusing up close. Monovision contact lenses is where we essentially undercorrect one eye, and just like how we have a dominant hand, we have a dominant eye, so we can undercorrect our weaker eye to give us kind of more range of vision and give us some reading vision. And then we can also just do contact or glasses and contact lenses where we correct someone for distance and then they just wear glasses up close, or for someone that's naturally nearsighted, they'll take their glasses maybe off for up close, but then they just wear their glasses for driving, for instance. There's also anti-fatigue glasses. I don't know if we're going to talk about that at all in any other presentations, but it's almost like I kind of call it like a baby progressive. So usually true progressives start at a +1 add power. So if you have someone that's younger that does notice a little bit of eye fatigue, you can recommend an anti-fatigue lens to help with giving them more focusing power up close. I think that's it. Any questions?